So welcome all of you to our briefing today relative to the CDC's work here in Wilmington and relative to the gun violence. But before we start, I would like to begin by acknowledging and remembering all of the individuals who have lost their lives to gun violence in our city of Wilmington and actually across our state, and all of the families who are indeed affected by the physical, emotional, mental trauma that has been associated with this violence. And during today's briefing, we will indeed talk about data, important data. But at the heart of this research, we must not lose sight that we are talking about real lives, real people, and real losses to families, to our communities, and to our society as a whole. As a result of the persistently elevated rates of gun violence in the city of Wilmington, Councilwoman Hanifa Shabazz proposed a resolution back in December 2013 requesting that the federal government Centers for Disease Control and Prevention assist in an investigation and provide recommendations for preventative action relative to this violence. I would like to take this opportunity to thank Councilwoman Shabazz. And in June of 2014, the Delaware Division of Public Health within the Department of Health and Social Services, with earlier concurrence from the City Council and from Mayor Dennis Williams, made a formal request to the CDC for their assistance. We asked the CDC to develop and analyze key data points to help determine a person's path towards gun violence. That analysis was done by the CDC researchers, and they conducted that research from June of 2014 through March of 2015. The CDC's preliminary findings were provided to the Mayor's Office, the City Council, and Governor Markell's cabinet earlier this year. Today, we are providing the final results of the CDC study. The report is one that looks at gun violence from a public health and social service perspective, not from a law enforcement perspective, or one that intends to designate individuals as potential criminals. It is a lens that looks at a variety of complex factors that could lead a person to resort to gun violence and hurt another person, and also how our system intervenes early before anyone is indeed hurt. We call this a predictive analysis. In addition, this perspective also does not apply simply to the Department of Health and Social Services or any one state agency, but it is used in the broadest sense. It is used from the perspective of health, social, economical, educational, environmental, and community experiences that individuals encounter every day. Violence is an issue that affects all of us, the state, the city, the county, and all of our communities. Therefore, the responsibility to stop cycles of violence, to find meaningful solutions, sustainable solutions, and to intervene early belongs to all of us. We also must be clear that examining motivations for violence and coordinating interventions to prevent it altogether, what we refer to in the public health sector as an upstream approach, does not absolve individuals of responsibility for committing criminal acts. However, as our partners in law enforcement say, we cannot arrest our way out of this problem. We need to engage the science or root cause analysis with a practice on the ground that will bring forth healthy outcomes. I would like to take the opportunity to thank the CD staff, including Dr. Stephen Summer, for their thorough, careful, and scientific approach to this study. Their charge was to assist the City of Wilmington and the Department of Health and Social Services to develop a risk assessment tool that examines the characteristics of individuals involved in urban gun crimes, provide data that could help determine future interventions, and to make recommendations to help monitor and prevent future violence. The CDC's research and the next steps that will result are making Delaware a pioneer among all states. This type of risk assessment has not been done on a state level anywhere else. Dr. Paul Silverman, who worked closely with the CDC during this study, will present the CDC's finding. Dr. Silverman is our Associate Deputy Director for Health Information and Science at our Delaware Division of Public Health. I now turn it over to Dr. Silverman.
Thank you, Secretary Landgraf. Before I begin, I just want to emphasize again that this is the work that was completed by CDC. I work for the State of Delaware Division of Public Health, and I'm presenting their work. If I'm happy to answer questions about the work. If they should become very detailed, then we might have to refer you to CDC. So today, in my remarks, I'd like to do three things. First, I'd like to explain to you the rationale for the approach of the investigation in Willington. Then I'll share with you what the CDC learned. And lastly, I'll introduce the major recommendations. So Wilmington is a city that is like many other cities in the United States in that there's two stories to be told. One is that there are many parts of the city that are beautiful, historic, and economically important to the entire region. But on the other hand, Wilmington is also a city with significant pockets of poverty and crime. As you know, unfortunately, gun violence has been a major and growing threat to the city residents, with the city often ranking at the top of homicide or crime lists. In fact, Delaware's growth in violence has been substantial, which has influenced a good deal by the city of Wilmington. This figure shows how homicide rates have changed over the last 13 years, from 1999 to 2012. If you can follow the cursor here, this is Delaware. The red dots are the homicide rate in 1999, and this represents the increase in the rate to 2012. And in fact, the homicide rate in Delaware, the increase during that time period is far greater than any other state in the nation. So the salient question posed to CDC is essentially, how do you prevent community-level urban firearm violence? And this is not an easy question to answer. When talking about individual-level risk factors, we've learned over the years that many of these risk factors are often very deep, fundamental experiences and characteristics of persons' life and environment that aren't quickly fixed. These are things like living in impoverished conditions, low educational attainment, unstable households, a history of abuse as a child, and exposure to violence, and being the victim of violence in itself. These risk factors are difficult to change, and intervening on them requires a coordinated and sustained approach. So then how can we possibly begin to meaningfully address these deep risk factors that so adversely affect individuals and are associated with violence? CDC staff began the investigation by trying to learn more about the individuals who have been involved in gun crimes in Wilmington and about the preceding patterns in their lives. The hope was to be able to shed light on how Wilmington could get further upstream in terms of preventing violence. CDC first analyzed arrest records for violent gun crimes in the city of Wilmington between January 1st, 2009 and May 21st, 2014. A violent gun crime was defined as homicide, attempted homicide, aggravated assault, or robbery with a firearm. From this data, 569 individuals were identified from about the last 5 years. These are people who had already committed a violent crime with a gun. You can see that the majority of these individuals are young, up to about the mid-30s, and 95% are male. Next, CDC staff looked across medical, child welfare, criminal, employment, and education records to learn about the patterns that were occurring in these individuals for the purpose of trying to better understand how we can assess the risk of becoming involved in urban gun violence and thus help these young people. CDC staff focused on trying to better understand the sentinel events that happen before these young people are involved in gun violence. Let me show you some of the major categories of sentinel events CDC looked at and how often these sentinel events occurred in individuals' lives who are involved in gun crimes. All of the statistics here came from administrative data, data that is already available and can inform programmatic work. Almost half the individuals who've been arrested for gun violence have themselves been a victim of violent injury for which they've gone to the emergency room within about the last 10 years. This includes things like being shot by a firearm, being stabbed, being in a physical fight, episodes of self-harm, and altercations with the police. In terms of labor events, 86% of individuals were unemployed in the quarter preceding their violent act. Now, some of the percentage is here relate to child welfare investigation histories. That is, more than a quarter were investigated as a victim of child maltreatment. About 7% were placed outside of the home. And in terms of juvenile service participation, more than half had juvenile services provided by the state. Half were in some kind of community probation prior to their violent act, and more than a third were under residential detection. In terms of school, 73%, nearly 3 out of 4, were recipients of some kind of assistance programs in the school, for example, free lunch. Almost half had a prior suspension or expulsion. A quarter dropped out prior to high school graduation, and more than half had more than 10 unexcused absences in the preceding school year. Some of the percentages here are high, some of them are not so high, but what CDC found is that, generally speaking, the young adults involved in gun crimes had multiple adverse life events, multiple sentinel events, before they committed a gun crime. Now I'll show you this information in a different way, beyond just providing the percentages. That'll give you a different picture. So this is a complicated slide, and I'll walk through it fairly carefully. In this figure, I'm showing you a timeline of 4 emergency room-based sentinel events for individuals up to about their mid-30s. So we have a gunshot wound, blunt weapon injury, a physical fight, injury, or encounter with the police. You'll first notice that on this axis are individual participants in this study. These are all people who committed a violent act, and there is 421 of them. Each one of these dots represent an event, in this case, on this panel, being shot previously prior to their criminal act. These lines represent when the individuals to the day committed their violent act with a gun. And this is the time period from 2002 through 2014. So what this shows you is that, for example, from this individual, there were 2 times that that individual was seen by Christiana Care for a gunshot wound prior to that individual performing a violent act with a gun. And you can see that some of the relative time between when these sentinel events occurred and when the violent act occurred. And we have the same kind of information here in this panel for blunt weapon injuries, the same for physical fights, and the same for encounters with the police that resulted in being seen by the emergency department. This information is the same layout, the same presentation for individuals relating to the child welfare system. All of these dots represent an investigation that was opened as a potential victim of child maltreatment for the individuals who would later go on to commit a violent act with a gun. And these dots represent out-of-home placement of those individuals. This information relates to the juvenile justice system. These dots, now more plentiful, represent those who were put on community probation, those who were put into a detention center of some kind, and those who had behavioral health services offered. And finally, these represent school suspensions or expulsions, and there are many, and many repeated for each of these individuals, and those who dropped out from school. Now, all of these sentinel events that CDC looked at represent data points that, when taken together, can be used to classify the risk level for violence involvement. For example, listed here are almost 20 pieces of administrative data that CDC looked at, some of which were in the previous slides, that can inform a risk assessment model. Typically, what risk assessment tools do is assign a certain point value to each type of sentinel event. The more influential ones get more points, and so ultimately everyone gets assigned a score based on the unique combination of events that they've had. In their investigation, CDC worked to develop a pilot test of such a point scoring system using a sample of state records. In this slide, I can show you an example of how important looking at and using risk assessment tools can be. This slide focuses on young men ages 15 to 29, the highest risk population for violence involvement. In this pilot sample of administrative data of 15 to 29-year-old males, there were 209 youth who had very high point scores, above 90, giving them an estimated risk of 90% or greater. Those are located right here. These represent 209 individuals. Ultimately, 205 of these 209 young men, nearly all, were subsequently involved in firearm crimes over the study period. These individuals who had very low scores did not commit a firearm crime. So this chart shows that the tool that was developed by CDC works. So why are risk assessment tools important? They are important because they often make good service delivery possible. First, they allow local officials and service providers to be more effective and efficient and provide these services at a lower cost. And secondly, they allow these young people who need the services the most to receive them. It's a way of assuring that people who need services don't slip through the cracks. Youth who have multiple adverse life events and are at risk of violence involvement need multiple wraparound social services. They need a package of coordinated assistance. Let me now explain what are some of the evidence-based or promising violence prevention strategies that could be used as part of a package of services. While I don't pretend to be an expert in these programs, let me point out that they're organized here by problem. So there are proven strategies that can be applied for individuals who go to the emergency department because of some kind of violence. There are those that relate to individuals who are on unemployment. There are those for those who had trauma from child abuse victimization, for juvenile crime involvement, and for school problems. But what you don't see here is a single strategy that is used in all of these settings. So let me now talk about the report recommendations. In summary, what CDC found in the study was that the majority of individuals involved in urban firearm violence are young men with a wide range of adverse life events, often repeated adverse life events, that preceded the commission of a gun crime. The sentinel events CDC looked at can serve as a marker that these youth need intensive help to prevent them from becoming involved in future violence, either as a victim or a perpetrator. Consequently, the first step is for us to further develop this pilot model into actual risk assessment tools that can be used by service providers. This risk assessment tool would best operate off of existing administrative data. Thus, an immediate next step includes developing the capacity of our agencies to link and share data in an ongoing fashion. Then, the pilot model CDC tested should be further refined and improved using the full set of administrative data. Lastly, this risk assessment tool could be used by state and local social service agencies to deliver evidence-based, comprehensive, wraparound services to the highest risk youth. The previous slide provided a few examples of promising strategies. There are resources to explore the full range of programs. CDC is recommending the creation of a community advisory board to help inform and guide the selection of specific strategies. So what this study has done is it provided a focused and feasible approach to efficiently and cost-effectively provide services to those at highest risk of committing a gun crime. The most important thing is that the impact can be great because we would be working directly with those individuals who are likely to go on to commit gun violence and need assistance the most. At this point, I'll turn it back over to the Secretary Landgraf.
Thank you, Dr. Silverman. I would also like to recommend, or would also like to recognize State Representative Stephanie Bolton, who has joined us this morning, along with Councilman Wright, who has joined us, as well as former Council President Norm Griffiths. Thank you for being here and for everyone else for being here. Now, as Dr. Silverman has discussed, through its science, the CDC proved that this concept of predictive analysis can indeed work, that individuals most at risk for violence can be identified, and if we apply that public health approach to the data that you've seen here, we can identify those individuals most at risk and actually intervene early with the appropriate services and supports. Now, because this concept is so new and it is considered pioneering, it will take indeed a multifaceted approach across all government entities and other institutions within our communities. It will also take a legal analysis and inclusion of both state and federal legal statutes and a coordinated strategy in moving forward. The answer to preventing gun violence is not simple, and this report demonstrates that there are no quick solutions that will end the violence today. The early interventions described in the CDC report are for the future and are indeed prevention-oriented. As I indicated earlier, gun violence is a larger issue than one that can be controlled by the state, by the county, by the city of Wilmington, or by numerous public and private organizations in the city and beyond. Reducing and preventing gun violence requires collective, focused, deliberate, intensive, coordinated effort. The scientific work done by the CDC is a significant contribution to how the collective we will meet the challenge of addressing violence. I have been charged by Governor Markell to work across our cabinet with the city of Wilmington, government and not-for-profit organizations, and throughout all sectors of Delaware to examine the CDC report, our current practices with both private and public agencies, and determine where connections are being made right now and where potential connections are being missed. As a strong advocate for a trauma-informed system of care, I believe we must recognize that exposure to violence and victimization leads to more violence and victimization, repeating that cycle over and over again. That cycle is made worse by impacts, by those toxic stressors such as poverty, a lack of quality education, or a lack of employment, and a history of abuse. As a community, we will need to work together to identify the best intervention that will break this cycle for the victims and for the perpetrators. Using the CDC report as a catalyst and as a guide, we will explore Delaware becoming the first state in the nation to use a complex, data-driven process to address individuals most at risk for becoming perpetrators of violence. Our goal will be to identify those individuals before their lives lead them to picking up a gun, and to intervene with comprehensive wraparound services and supports that can change their lives' path. We are already engaging with the University of Delaware to refine and improve our data collection process at the Department of Health and Social Services, and we will further explore a broad-based risk assessment tool. We will form a community advisory board comprised of representatives from all sectors, and that builds on the strength that is the city of Wilmington and its citizens. The board will be a joint effort and co-chaired by one representative from the state and one representative from the city. I would like to invite the city of Wilmington and all of our partners to join me in that effort as we explore utilizing data into real on-the-ground strategies. There are many good programs, many innovative programs, projects, and people in our city right now, today, and I appreciate the CDC highlighting the importance of celebrating our city. We will make announcements in the coming weeks as we seek community input and involvement in the advisory board and our next steps. Finally, the challenges presented by gun violence did not occur overnight, and they will not be solved overnight either. We must develop a sustained path for moving forward, one that involves our entire community. We look forward to the work that lies ahead. and we appreciate your investment and being with us here today.
Okay. I'm satisfied to the point where we have scientific proof to support what we have known for quite some time, that we have a deficient educational system, that we the implementation of social services are not fulfilling the needs of the community, that the various departments in the state do work in a silo, and that if you're in compliance with one for your child purchase of care, that you're out of compliance for your food stamps. And this is the additional trauma that individuals go through, and that causes the distress and dysfunction in a household that then is fed down to our children. It does demonstrate the numerous encounters that the city residents come into contact with those different departments, and in all of those different contexts, there's not been adequate intervention to stop this violence.
Well, a lot of this stuff wasn't new. What surprised you the most about the findings?
Well, no, I was surprised as the massiveness of the educational component, the educational encounters. I mean, we got raised to the top dollars, okay, and so much there with the education. I was also surprised of the amount of encounters that they had with the police, okay, the police that from the Christiana Hospital. I was surprised at that. But we all know that there had to be something that was causing this issues, which is what drove me to ask for this from the very beginning. That is not the action and nature of my children. And I'm speaking of the African American children in the city of Wilmington. I knew there had to be something else that was causing them to be other than themselves, that the environment was toxic, that's causing this mental dysfunction in having such heartlessness to take someone's life. I knew it was. So it makes me feel better that I just wasn't just on a whim, that it's scientific data that backed my findings, I mean, back my thinking, and now that we have gotten that, now I need the support of everyone in the city of Wilmington and the state and our congressional delegation to see that we're in a state of emergency. We're in a state of emergency, and that as with any other epidemic, quarantine, you know, that's how they do in scientific movies. They put fences around everybody. They quarantine people based on what your stage of the epidemic is, and they fill you with vitamins and nurturement and love and affection and all those things that are necessary to get the person healed again. That's what I feel we need to do.
So how do we go about that? What would be our true next step?
Well, how do we identify who those children are? I mean, I think mainly it's just to make a plan that we're going to do it. Okay, I don't have all the answers, but there is a whole community out there that has expertise, whose expertise and knowledge I truly respect. And I mean, even the idea of the task force, community task force, I do agree with that. And pulling that together and immediately setting down. But I just hope that it doesn't drag out to another 6 months, another 10 years. We've already waited 2 years already. And last night was a perfect example that we are bleeding from every area, that we need to put 24-hour, 365 attention to this, to come up with some action. And even if it's just a shot of vitamin C, a set of vitamin love, or just addressing the families, of finding a youth intervention specialist in the street, something to let our community know that, hey, we know that you're not feeling well, and we're here to make you feel better. Well, I know in order to make all of this come to a reality, it crosses many different departments and many different entities, and there's legalities, whether it's federal mandated rules, regulations that we're all complying with, and then you have to convince. My understanding, the word was used of buy-in of secretary, different department heads to see this as a direction to go. I request, to address that, I would request that the governor do an executive order and to direct his cabinetry to move to do this. There's no such thing as buy-in. It's what is mandated that needs to be done, and everyone's personal opinions should not be included in this. We have scientific proof that this is the direction we need to go that came from the feds. We have a congressional delegation that's full of support. So it should be a directive given that this is the direction that we go, that we implement the recommendations, that we put the risk assessment tools, the data systems in place, and that community task force suggestions be implemented as soon as possible. As soon as possible. That's what I would request of the governor and our congressional delegation and our leadership here in the city of Wilmington to stop the killing of our children.